When we think of donating, we often think of our money or our time, but there's a more personal way you can donate that could save someone's life. I'm talking about signing up to be a bone marrow donor to help those with blood cancer. Joining me now with more is Dr. Andrew Pecora of the John Thur Cancer Center, one of the top hospitals for bone marrow transplants. Good morning, Dr. Pecora. My first question for you is, are there certain blood cancer patients who are better candidates for bone marrow treatment, or can anyone suffering from this benefit?
Yeah, so there are specific types of cancers, particularly leukemia, lymphoma, and multiple myeloma, where in some circumstances bone marrow transplantation is the only curative option that that patient would have.
All right, how hard is it to find a match, and is there a way to improve on those odds?
Yeah, so if you're fortunate enough to have a large family, your odds of finding a match are better. So there's a 1 in 4 chance that any brother or sister would be a match. If you don't have a match within your family, you can go into what's called the National Marrow Donor Program, where you are, your immune type, your immune address is put up against a database of unrelated donors. These are people from around the world that have chosen to be gracious and allow themselves to be a potential donor, and there your chances are about 50%.
Now, it used to be that if you couldn't find a match within your family, your rate of survival was very low. Is that still true today?
No, not at all. Because of the National Marrow Donor Program and because of the graciousness of people who are willing to become donors, we have now developed technology that the survival rates are equivalent whether or not you get your stem cells from a brother or sister or from an unrelated donor. So really being a donor in the unrelated setting could save somebody's life. All
right, how can a person get onto a bone marrow registry?
Yeah, it's actually very simple to get onto the registry. The NMDP has a website called bethematch.com, bethematch.com. And that would direct your listeners in Ohio to a local center where you would go close to their home. They have a cotton swab of the inside of their mouth. It doesn't hurt at all. And cells are taken, and we look at your immune type, and we put that into the data bank. And then about 1 out of 500 times, your immune type will match up with someone who needs a stem cell transplant, a bone marrow transplant's immune type, and then you're called back. If you happen to be called back, this is totally voluntary. You can always say, you know, change your mind. You don't have to do it. But if you're gracious enough to do it, you come back. It's a simple blood test, an examination. The doctor determines if it's safe for you to be a donor, and if it is, you can go forward.
Wonderful. Dr. Pecora, where can we go for more information on all of this?
The best place to go is to the website bethematch.org, bethematch.org, and it will describe everything you need to know about becoming a donor.
Thank you so much, Doctor.
Thank you.